Hello, everyone. Welcome, welcome, welcome. Good evening, Charlene. Hi, Kim. You made it. Hi, Charlene. Let me take my
Okay. I'm still
everybody
traveling, but I'm here.
is still traveling. Oh, you're in the hotel room, huh?
Yes, last week I was in San Antonio in a hotel room, and now I'm in St. Thomas in a hotel room. So,
Wow. Oh, wow. I bet the weather in St. Thomas is nice.
yes.
Yes. Yes, yes, yes. Well, I'm glad you were able to join us. I hope all is going well in your travels.
Yes, the space debris grounded my plane for a little while. I was like, these things only happen to me. Then there was some type of defect on the plane, so we had to wait and have somebody come and check it out to say, okay, you can fly now. Now that we're all terrified.
Oh, wow. Oh, wow. Wow, wow, wow.
But yes, other than
Mm-mm-mm.
that, beautiful.
Beautiful, beautiful, beautiful. Hi, Adam. How are you doing this afternoon?
Yeah.
Good, 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 good. I know my son was traveling a few weeks ago and they were getting ready to take off and they was like, "Ooh, we got something wrong with something, a sensor or something." And they end up staying on the runway for about an hour. I said, "Well, you know what? It's okay." I am so thankful that they were able to, pay attention, right? And it was the same day. It happened the same day that the airplane turned over. It was that same day. Yeah. I think it happened earlier that day and his flight was later that evening. So, yes, yes, yes. A lot to be thankful for. Mhm. Well, it is 6 p.m. We're going to go ahead and get started. We do have quite a bit to do tonight. Before we get started, I do want to read Dr. Sellers' Educate is approved as a provider of nursing continuing professional development by the North Carolina Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. To receive contact hours, you are required to stay for the entire program, watch the full recording and complete the evaluation. Can you believe we are at week 5? Wow, wow, wow. It's going by so fast. Going by fast. We are at week 5. We have one more week to go. And I must say, I always get so connected. It's like I get ready. Oh, I'll go get to see them tonight. It's Tuesday. Yes, yes, yes. So I hope that this prep session has been very valuable for you. Even though we're coming to the end, I will not leave you. You'll still have access to all of the resources, and also you'll have my email address, and you can still email me. I hope some of you will be taking the test shortly. Don't wait too long. I will be available for you, even if you say, "Hey, Dr. Scott, I just need just a little extra." Just please don't hesitate to email me, okay? I'm here to support you right all the way to the testing, and we'll celebrate afterwards as well. We'll put our little hands up and clap and laugh and do all what we need to do. Even if we're going to shed a few tears, we'll do that as well. So I just want to let you know I'm there for you. Even if you're waiting longer than the next 4 weeks, I'll still be there. You can always email me when you're ready and say, "Dr. Scott, I had to take some time, but I'm ready now. Can you do a refresher for me?" So please just know that I'm still here for you, okay? All right. I hope the documents were very useful for you with theories that we sent out last week. If you did get a chance to look at them, you have access to them, okay? And I hope they would be very helpful. I was able to put some simulation scenarios and examples with the theories that really kind of help connect them a little bit. Again, when you think about the theories, try not just to memorize the theories, but what are the principles of the theory and how they overlay into simulation. So if you saw it in a case study or just a blanket question, you are able to choose the correct answer as a simulation expert. So try not to memorize that, but tie it to how it impacts simulation and from the start to the finish. Tonight we're going to talk about evaluation. and look at a little bit. I have another slide. This is our schedule for tonight. We'll do our simulation dictionary. We'll do 10 terms, and then we'll take our quiz, do a nice little 15-minute break. We'll come back and do 2 chapters, do a 15-minute break, and we'll finish it off with that final chapter 21. And then our chapters for our last session will be chapters 22 and 24. And during our last session, the quiz, after we do our section 22 to 24, we're going to spend time actually in the back of the book doing the last cumulative exam. So we will do, it's going to be a lot of questions our next session. So we'll spend the last half giving you the opportunity to actually take that exam while we're in the session. So please plan to do that. We'll take a nice 15-minute break, and then we'll come back, and then you'll have space to take the exam. We won't do all 100 questions, okay? You'll have an opportunity to have questions remaining after this session to continue to practice once you're done with the CHSE prep, okay? May just try to do 20, just depending on how we feel next week. 25 would be real sweet. But I do want to be able to give you enough time to take those questions while we're in the session. And then we'll come back and do our rationales and talk through them, and then we'll be done. Okay? Any questions about tonight? Any other questions? Please don't hesitate to send messages in the chat if you have any questions. Don't hesitate to do that. Hi, Lori. Welcome. Nice to see you. Hi, Valerie. How are you doing this afternoon?
I feel like I've been running all day, so this is good. We had a full day of simulation today, so I'm like, okay, let me
Right.
get on right.
Yeah, you were back from spring break, correct?
We went back, we only had the first 3 days. So
Oh, okay.
we only had the
Oh.
first 3 days. And Thursday, I'm on the QEP committee, so we've been presenting and doing some stuff with IPE, and so it was it's been a busy time. Yeah.
Well, I'm glad to see you here with us tonight. Lori, you doing well?
Doing great.
That's
Busy day as
good.
well. Busy day as well.
Busy day as well. Well, thank you so much for taking time to have some fun with us tonight. It's a different pace, so hopefully it'll be nice for you on tonight. So glad to see both of you join us on this afternoon. So we'll go ahead and get started. We're 4 minutes ahead, but we'll go ahead. I'm sure those 4 minutes mean something to us a little later on as we continue to move forward. But let me go over here and minimize that. Oh, there we go. Okay, these are our chapters on tonight. We're going to do chapter 18, standardized patient debriefing and feedback, chapter 19, evaluation of simulation activities, and then chapter 20, fostering professional development in healthcare sim, and chapter 21, the role of research in simulation. So those are our focus chapters on tonight, and we'll go ahead and look at our terms. We have 10 terms identified. We're going to look at tonight, starting with educator in your simulation dictionary, healthcare simulation dictionary. We have educator, a clinical simulation professional whose responsibility is develop and implement clinical simulation based education designed to enhance patient safety and quality during healthcare delivery, should be able to run scenarios and debrief students using their clinical experience. In other words, they should be content experts. They should follow scenario objectives and facility standards, as well as conduct debriefing sessions with student learning in mind. Our next one, embedded patient. Actors who play a role assigned in a simulation to help guide a scenario. A role assigned in simulation encounter to help guide the scenario. The guidance may be positive, negative, or neutral, or as a distractor depending on the objectives. the level of participants and scenario. We do have a NASCO standard there that we can take a look at. We're going to look at environmental fidelity. We talked about fidelity a few weeks ago, the degree to which equipment and environmental cues distinguish information as real, objective fidelity, or as subjectively experienced perceptual fidelity. Looking at evaluation, marking a judgment or determination concerning the quality of performance, work product, or use of skills against a set of standards. And we'll look at some evaluation on tonight, this afternoon. Extended reality, we talked about that a few sessions ago as well. Umbrella term that kind of talks about the fusion of all the realities under one umbrella, including augmented reality, virtual reality, and mixed reality. Which consists of technology mediated experience enabled via a wide spectrum of hardware and software, including sensory interfaces, applications, and infrastructures. Next term is facilitator or simulation facilitator. Individual who's involved in implementation and delivery of simulation experiences or activities. It could be faculty members, educators, clinicians. Simulation facilitator development should be guided by a set of common facilitators. Let me let Erica in right quick. Consensus and evidence-based practice. The elements include able to create positive, comfortable, trusting atmosphere and learning climate, emotional safety. Let's see, is someone else? Okay. Ability to bring theory and practice together, able to pose as a real world role model, passion for teaching and learning, flexibility or adaptability to what the content can offer, and human-centered approach. Another thing, facilitators provide feedback as it is part of the learning process. During the analysis or discovery phase, the facilitator assists the learner's exploration into the experiences, facilitates understanding of material, and helps identify knowledge gaps. Facilitators are challenged to maintain a safe learning or evaluation environment during the debriefing process. Individual who helps to bring about an outcome such as learning, productivity, or communication by providing indirect or unobtrusive assistance, guidance, and or supervision. Let's see, the other word is feedback. We'll talk about that a little bit tonight too, an activity where information is relayed back to the learner. Feedback should be constructive, address specific aspects of the learner's performance, and be focused on the learning objectives. Information transferred between participants, facilitator, simulator, or peer with the intention of improving the understanding of the concepts or aspects of performance. Feedback can be delivered by the instructor, could be by the machine or the simulator, a computer, a patient, or a simulated person, or by other learners as part of the learning. Fiction contract. Love the fiction contract. It's an explicit agreement between the learners and the instructors, or the facilitators, which encourage the learners to put aside their disbelief and accept the simulated scenario as being real for the duration of the scenario. Effective execution of this agreement depends on equal involvement of both parties. Each party has certain responsibilities. Establishment of a fiction contract, suspension of disbelief will ultimately minimize the blame that a learner can place on the realism of the scenario affecting their performance. Fidelity, we've talked about that before. It's really nice right up here when it talks about fidelity in the dictionary here, and we've talked about it already. The degree to which simulation replicates the real environment or workplace includes physical, psychological, and environmental. We'll just skip down here. Fidelity, the levels of fidelity, let's see. Fidelity in simulation is a multidimensional concept corresponding to the degree of realism created through the selection of the simulation equipment, setting, and scenario. Fidelity also refers to the degree of exactness achieved and corresponds to the believability of the experience and relates to several components of the simulation activity. Standards do not dictate the level of fidelity. Rather, the level of realism should be at which promotes the achievement of the expected learning outcomes. The level of realism should be at which promotes the achievement of the expected learning outcomes. Levels can be low, mid, and high fidelity, and types physical, psychological, and conceptual are associated with fidelity. Participants and educators stated preference for higher levels of fidelity, judging it as superior to lower levels, but there's really no true evidence in research that really supports that. You can achieve your outcomes with a low level, low fidelity, just as well as with your high. Let's see, formative, our last one of this afternoon, which will take us right on into our questions this afternoon. Formative assessments refers to tools that identify misconceptions, struggles, and learning gaps along the way, forming learning along the way, and assess how to close those gaps. It includes effective tools for helping to shape learning, form learning, and can even bolster students' ability to take ownership of their learning when they understand that the goal is to improve learning, not apply final marks or grades. It can include students assessing themselves, peers, or instructors through writing, quizzes, conversation, and more. In short, formative assessments occur throughout a course or class or course and seeks to improve student achievement of the learning objectives through approaches that can support specific student needs. It's the type of assessment where the facilitator focus is on participants' progress towards goal attainment through preset criteria, a process for an individual or group engaged in a simulation activity to provide constructive feedback for that individual or group to improve. Okay. All righty. So we have made it through our definitions. We will now go to our first quiz. Everybody ready? Let me cut some light on here. So we will start in chapter 19. Chapter 19, evaluation of simulation activities. Evaluation of simulation activities. Question number 1, and we will continue. We will put our answers in the chat box, and we'll have anyone that would like to share why you chose your answer, but let's talk about even more why the other answers are incorrect. Okay, and talk about, identify what in your question helped you to choose the right answer. Number 1, a faculty member is planning a formative simulation activity. When is the best time for this activity to occur? When is the best time for this activity to occur? We're on chapter 19, page 323. Well, hold on a minute. Make sure. Oh, I'm sorry. I am ahead. Thank you, Adam. Sorry. Chapter 18. I'm sorry. 305. I'm already ahead. Thank y'all. Y'all gotta help me. No. Thank you. Chapter
I thought you were
18.
doing it for a reason. I was like,
No,
oh,
I really wasn't. I'm sorry. Thank you, though. We're on chapter 18. Chapter 18, focus standardized patient debriefing and feedback. On page 305. The novice simulation educator understands feedback when they state feedback is A, just another term for debriefing, B, one tool of debriefing, C, best delivered by peers, D, a process of self-reflection. Yes, B is our correct answer. Who would like to share why we chose B and not our other choices? What led you to B? Is correct. A novice simulation educator talking about feedback. Anybody?
So I said B, well, I said B, of course, but I was just thinking that, if they've read the standards, I know here at our facility, I have any new person coming in to teach, to go over the standards, the core four at least. And so it typically will say that in the standard. I also thought, a lot of that, all of those could possibly be true. I mean, somewhere in there you can kind of use feedback for debriefing or whatever you want to call, but that would be the best, and that's part of that standard. So I try to look at that from how are we giving that content to our new educators, or how am I delivering that to them? So
Exactly. You think about reflection a lot, just another term for debriefing. So you're right. The best choice is the one tool. It's a tool of debriefing because we do provide feedback as we ask those questions to cause the students to reflect on their behavior, right? We provide them feedback even in our session of in debriefing. So feedback is a debriefing tool that focuses on providing learners with information about they did well, and what competencies need improvement. It is not another term for debriefing, and it is not usually provided by peers. Feedback is given by another person so that it is not a process of self-reflection. Sometimes peers do give feedback, so I'm inclined to say, yep, B is the one answer that is the best choice. Thank you, Valerie, for sharing. Number 2, the simulation educator prepares the learners for debriefing. A, to teach them debriefing methods and tools used in the process. B, as an optional formative peer evaluative process. C, as a summative self and quality improvement tool. Or D, to assist them to participate more effectively in the process. Yes. The answer is D, increased participation. D, who would like to share?
I said, I think with that one, your explanations for the previous question kind of helped narrow that down, because it was kind of one of those where it's like, okay, it's not to teach them anything. It's not optional. And then it's not self-reflective. You're like, well, I guess it'll be D.
Yep, we're going to get them more and more. You're right. It's D. Okay, that's a great way to look at it. To assist them to participate more effectively in the process. Debriefing works best when the learners are part of it and engaged in the process. That's why it's so important to make that environment safe. And you start that psychological safety from pre-briefing. When they first come into your area, you are already setting the stage for a safe psychological environment so that they feel comfortable, even going into the sim, even though they're nervous. They feel comfortable. And then when they come into debriefing, you want to make sure that environment is safe, right? Because most of them are beating themselves up if they don't feel like they've done a good job. But making sure that environment is safe, because once you start asking those questions and they feel safe, they're going to start answering more. They're going to start being very transparent and honest, right, about their behavior. So debriefing works best when the learners are part of and engaged in the process. Learners do not need to know the difference between debriefing methods, and it's not a peer review process. Reflection and self-improvement are part of it, but students need to be prepared to participate in the self-reflection and improvement. And if you keep that environment safe for them, most students will engage in it. Even your introverts, so the ones that don't talk as much, if that environment is safe enough and the other students start talking, before you know it, that introvert, they're going to say something. And when they do say something, you're able to maximize their comments in a very healthy way. Before you know it, they're talking all over the place as well. 3, a standardized patient would like to participate in debriefing with the simulation educator. The simulation educator understands that A, every SP has been educated in debriefing. B, debriefing is more difficult than communicating an assessment. C, debriefing is of more use than just giving feedback. Or D, debriefing is a complex activity for an SP to master. Yes. Remember we talked about SPs, I think last week. SP's roles, they can give some feedback, but they're not the one that's going to actually facilitate that debriefing. You need someone that is trained in debriefing to do that. So the correct answer is the simulation understands that debriefing is a complex activity for SPs to master. Every defined debriefing is a complex skill, and not all SPs are prepared to conduct the debriefing. They can add. Not all SPs have debriefing education, and it is just as valuable as feedback. Communicating assessments is also complex, but it is not the main objective of debriefing. Okay. Number 4, the reason SPs provide feedback on communication is because A, they are in the best position to judge learner communication. B, it is easier to evaluate communication than the physical assessment. C, they are trained and practiced to provide feedback. And D, they are trained to assess therapeutic communication. And we kind of had a question similar to this the last week, I think it was. Yes, yes, yes. A is our correct answer. When we think about SPs, remember communication and SPs, those go hand in hand. They're the best ones to evaluate communication and provide that affective domain in our simulation. So they are the best person or best position to judge a learner's communication. They can provide that real feedback. SPs are in the best position to judge learner communication since they are the recipient of the care and interaction. All assessments are difficult, and SPs are educated and trained in their role, which can or cannot include scripted communication. Okay. Number 5, the simulation educators debriefing a student after the student performed a physical examination on a SP. The most productive debriefing method includes A, telling the learner directly what they need to improve. B, showing the learner how the physical exam should be performed. C, asking the candidate to retry the exam and correct as necessary. Or D, letting the SP debrief the learner after the physical exam. I would love to hear your answers. Why we chose B. B is correct. Someone unmute your mic and let me know why was B the correct answer. Why did you choose B? It's correct. B is the correct choice. Kim, would you like to share why you
Yep.
chose B?
Sorry, I was trying to get my little click to move. I actually chose it. I have found that when we can work with the student right then and there and show them their technique or the technique that they did versus the correct way, they seem to keep it and are able to recall it in future simulations then, rather than. Or another example I have is they're doing Foley catheter insertion. They break sterile technique. If we don't identify that with them right then and there, it's like, well, no, I didn't. Kind of a thing, unless you're recording it. So I like that in the moment teaching piece of it so that I can show them that
Okay.
their technique.
And if you're in your debriefing, you've already moved from that space and you're in that debriefing, it's very good to be able to roll, or like you say, show that to the student, even in your debriefing space, those things that were done incorrectly. You're so correct. Thank you so much.
What we actually do is before we move into the debriefing area, once the sim has, we have stopped the sim, we take the students right over to the simulation right then and there and show them right there before we move into the debriefing area so that they can see the setup, look at it, where things were, and etc.
Okay.
We always build time in to do that. So I have that option.
Okay. And like when you think about your best practices, once they're done with that sim, sometimes if you think about your Insight 2 Sims, they don't always have a room that they can take the students to debrief, right? Your best practice, you'd want to go ahead and debrief away from that scenario so that you're taking them in that space where they can actually feel like they can actually communicate the way they're feeling. I always want to say, get those students away. I say, no talking, let's get over. We want your true feelings, because if you have them doing other things, a lot of times it taints the genuineness of how they truly feel. Because if you catch them, they take them over to that next room away from that patient, put them in that room where they're able to start debriefing. You're seeing facial expressions, and they're able just to really let that win out. But I do like the way you're able to incorporate that into your simulation program, especially if you're having students that have some type of problem with assessment or et cetera, et cetera. We usually go ahead and move them on over to that sim debriefing space, get them talking, get them debriefing on what went well, and what would they like to change. And as we go through the debriefing session, kind of go through the end. And if they're video debriefing, they start seeing those things as well in the video, and you're able to pause and start talking and bringing equipment in, et cetera, et cetera. Thank you for sharing. Thank you for sharing, Kim. So our answer, we were on, let's see, showing them the exam, the most productive, number 5. Demonstrating a competency is the best way to ensure learning. Telling the learner directly or asking them to retry may not produce the correct competency. The SP is not the best person to debrief healthcare competencies because they are trained in feedback, but not always in debriefing technique. Number 6, the advantage of using Pendleton's rule for debriefing is that A, it helps both the standardized patient and the learner prepare for debriefing by listing positive performance and tells the learner what to do differently. B, it is an easy technique for SPs and simulation educators to remember and repeat as often as needed. And C, research shows it's an effective debriefing process and produces immediate improved competencies in learners. And D, learners like to get both positive and negative feedback in that order and build confidence in skill attainment. And our correct answer is A, yes. It was more or less knowing Pendleton's rules on page 301. So we're there. It says, Pendleton's rules helps prepare for debriefing and provides a debriefing process. The technique is not necessarily easy and does not produce immediate results. Learners usually do not like negative feedback. So correct, our answer is A. Number 7, the simulation educator can best ensure standardized patient debriefing quality by A, giving the SP feedback about the debriefing. B, asking SP to self-assess their work after reviewing the videos. C, question the SP about their knowledge of debriefing. Or D, using a debriefing quality assurance checklist to note SP behaviors. Yes. Yes, your answer is D, having that structured tool, right? That we can actually use that tool and they're able to see where and get the feedback. That is the best choice. That is the best choice. Using a debriefing quality assurance checklist, something that's pre-measured for effectiveness. It also allows for that SP to get the feedback they need. The change and enhance their performances moving forward. A checklist ensures consistency and is a good method to audit the SP's interactions. Feedback helps as the self-assessment, but a checklist can standardize it and provide consistency in our feedback to them. Standardize correct debriefing techniques. Questioning the SP directly does not assess the debriefer's behavior. Standardized standardized tool of assessment, not only for our students, but for us as not only as they're evaluating the simulation, evaluating the facilitator, but also in providing feedback or evaluating your SPs. Your standardized tool is really helpful. Number 8, an effective attribute of healthcare providers is empathy, which can be demonstrated in simulation by A, the standardized patient understanding the learner's frame of reference, B, the SP acting warm and caring toward the provider, C, creating a psychologically safe space and culture for the learner, D, an adult learner approach where the SP holds the learner accountable. Yes, Lori, can you tell me why you chose A? A is correct. Please.
Because we need to ensure that we're on the same page, kind of. And by knowing where they are in that situation, we can better understand how we are working with them towards their goals.
Exactly. Understanding where that student is at, that student's frame or reference. The SP can understand the learner's perspective and role model empathy for the learner. Empathy is more than caring. Creating a positive learning environment is part of empathy. It is not an attribute specifically of adult learning theories. Okay. Number nine, the simulation educator promotes a reflective debriefing model in order to A, promote positive learning, B, provide appropriate feedback, C, promote self-assessment, D, provide the standardized patient's time to reflect. Yep. The correct answer is C. Adam, can you tell us why you chose C, promote self-assessment?
It's ultimately like what debriefing, the goal of debriefing is to promote self-reflection, self-assessment, and furthering knowledge.
Exactly. Exactly. Promote self-reflection in learners will assist them in lifelong profession to continue to grow and refine competencies. It does promote positive learning and provide feedback, but this is not the main goal of debriefing. It does not necessarily promote time for the SP to reflect. Self-reflection, self-assessment, leading to change behaviors as they move forward. That is the goal of debriefing. Number 10, thank you, Adam. The novice simulation educator needs additional understanding when they state that using the sandwich style of feedback, A, makes learners active participants, B, can work well as reflective feedback, C, is congruent with physical examination debriefing, D, places the debriefer in charge of what to discuss. Yes, A. Our answer A is correct. A is correct. Great, 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 great. A is correct. Makes learners active participants. The sandwich style of feedback is passive learning, not active. It can work well with competencies and reflection, but it does place the debriefer in control of the conversation. I see you did this well. When you gave your medication administration, you did your 5 rights. And then you come back and say, but however, I noticed whenever you were ready to leave the bed, you did not educate the patient well or follow up to see if the patient had any questions. And then you put that last little layer of that sandwich on. But overall, I think you did a very good job in your simulation as the primary nurse today. So making sure we do the sandwich approach, it really, really does lead to those students being even more active in the debriefing. Because then again, you're fostering that safe environment, right? Letting them know in a very healthy way, yes, you've done something good, but this was my concern. But overall, you still was able to round it off in a very healthy way. That really causes that student and causes self-reflection in that debriefing environment to really be healthy. Okay, well, we're done. We are really ahead of time. It's 6:36, and I think I wanted to take a break. We may be able to go ahead in to let's see, how are you feeling? You want to go ahead and let's do chapter 19? Or y'all want to go ahead and take a break? For some, we've been running all day. We can go ahead. Let's see, it's 6:50. Well, we'll go ahead and take a break. We'll go ahead and take a 15-minute break, okay? And then we'll be back and then we'll do our 2 chapters. All right. So we'll go ahead and break at this point, and we will be back in 15 minutes, okay? I'll put the time here in the box in the chat. Okay. We are back. We're now on chapter 19. I hope everybody had a nice little break. We'll go ahead and get started. Chapter 19 talks about, let me put my camera back on, my apologies. Okay. Evaluation of simulation activities. Evaluation. Formative, summative. High stakes. On page 323. 323. A faculty member is planning a formative simulation activity. When is the best time for this activity to occur? When is the best time for this activity to occur? Formative simulation activity. A, at the beginning of the course, before any learning has occurred. B, near the end of the course, but before the final evaluations. C, shortly after the content has been taught in class. Or D, as part of the final evaluation and grading process. Yes, C is correct. C is correct. Valerie, can you tell us why you chose C?
So yes, I was thinking about how we do our NUR 111 or our nursing fundamental skills. So we give our students ATI videos to watch and prepare to come to class, and then we give them, you know, some task trainers, and we have some nursing and mannequins that we let them practice on. And so as they are practicing, it's not necessarily a formative, you know, evaluation or whatever, but we're talking to them and giving them feedback and watching them do their skills. So that's kind of where I was thinking, hey, as we are walking around, we're giving them some feedback on what we're seeing, you know, them do in practice before they actually get to any type of checkoff. So that's why.
Okay. Okay. Anybody else want to chime in as to why the other answers were not correct? Because C said shortly after the content. A said at the beginning of the course, before any learning has occurred. And we're talking about formative evaluation. So what's so key about formative evaluation? The students at least, or the participants at least, need to have what? Some type of content, right? Some type of content so that you can evaluate, do they understand the content? If not, you're going to provide feedback, right? And then they're going to have another opportunity to demonstrate or to show that they know how to do the skill, or do they understand the concept that you taught on, right? And if not, you're going to continue to provide that feedback in efforts to get them to the end to where they totally understand the concept and they're able to demonstrate that understanding, transfer that knowledge to practice. Right? So you're forming their learning. So when you look at A, we know that wouldn't be the answer, because you're going to do the activity before you even have taught anything. And then B, near the end of the course, but before the final evaluation. Well, yeah, we could, you know, you probably would, you could give some, say, hey, you're getting close to the exam and you kind of want to see if they didn't understand the content maybe you taught prior to that last exam. But C really is our best choice shortly after. Shortly after. When you look at B, they've had some time. We should have caught them early, right?
Mhm.
Shortly after the content has been taught in the class, we're able to get those students to a safe place, find out where their deficits are, where the gaps are in learning, and actually provide the feedback. Likely when we're doing the skills, I like when you use the example, I think you said Foley catheter, urinary Foley catheter exertion. If you're noticing that they're struggling with sterility, you're able to stop them, right? Show them where they're breaking sterility and then allow them to go back and perform the skill again before they actually get to that final validation. D, as part of the final evaluation and grading process, final evaluation and grading process, that's summative, right? So it wouldn't be a need for a formative activity at that time. Formative activities are helping our students formulate that learning. Formative learning and evaluations are not the final grade and are best done after the content has been taught in order to reinforce the knowledge. It should not be done at the beginning before there is an adequate grasp of the knowledge. Yes, Erica.
Hi, I just have a question. I'm getting a little confused with, I know when they're in a simulation, we're not supposed to stop them, correct? Like we want them to continue and then we debrief them after. But then I've been hearing with some of these questions that we would stop and do additional teaching. I'm getting confused on when we would allow that and when we wouldn't.
Hey, that's a good question. Now, if you're in your simulation, right? If it's not a OSCE or summation, high stakes sim, you cannot provide that feedback, right? If it's high stakes,
Okay.
you cannot stop them. That's a high stakes simulation where they pass or fail, moving from one course to the next. You see that a lot in your medical simulation. So in that environment of a sim, you cannot provide that feedback. But say this is a formative simulation, right? You're just wanting to see if they understand the concept of oxygenation. Say it's a respiratory simulation, right? They had the content in class and they're coming to the sim lab to actually do the simulation to see if they can make that connection with content and skill. So if that student is in that sim and you're noticing that they are going off to away from their achieving their learning objectives, you can call what they do a timeout, right? You can pause that sim and start asking the students questions. You wouldn't stop and start teaching, but you can do or you could provide cues. You remember we talked about cues in a previous sessions. If you don't want to pause and do a timeout at that point, you may either have the mannequin or the simulator, your human patient simulator, or your actor, or you as the facilitator, you may start doing cues to see if you can kind of veer that student back to achieving the learning objectives. If not, then you can call a timeout. And during that timeout, you're going to ask those sword cards. You're going to ask question, can you, Jane, help us to understand what you're thinking right now? Or oftentimes when my simulations, I will have them pause and say, your CI is in the room. Can you please give them a SBAR report? Can you give them assessment, a view of assessment, give a handoff report and let them know what has happened so far. And then the student will start talking. And then the next question I would say, so tell us what is your priority right now? So you're not going to stop and teach, but you're going to answer those questions that kind of get them back to achieving the learning objective. You can do that inside of your sim.
Okay.
Just to try to get those students back to a healthy place to stay on track to achieve the learning objective. Because if they're going away from that learning objective, guess what? Your simulation, you will never end. And that's not your goal with simulation. It's to be a safe space for learning to help those students achieve the learning objective of the simulation. Now, if it's a high stakes sim or OSCE, you cannot stop at all. You can't provide cues. You can't do no timeouts. It's summative. But formative learning, you can. The thing about, and I think that's why doing simulations, you want training. It is acquired. You do it, the more you do it, you learn how. Because I find that educators that are in the classroom all the time go to sim. It's very hard sometimes to stay on that side that you don't just start teaching. To go ahead and do your whole lesson. Before you know it, you're going through all the ABGs, you're going through everything. But no, this is an experience different from you being in the classroom doing your whole lecture.
Thank you.
Did that help a little bit, Erica?
Yes, thank you.
Mm-hmm. Okay. Anybody else have some feedback that they would like to share from your experiences as well to Erica's question?
Well, we have implemented for our first year students only the timeout.
Mm-hmm.
Because sometimes they recognize themselves.
Yes.
They're kind of lost. I'm lost, or I'm not sure, what to do next, or if I'm on the right path. So we give them a timeout that our first year students, regardless of semester, if this is their first time in simulation, that they can raise their hand and ask for a timeout and then proceed to ask their questions.
Mm-hmm.
We typically don't just provide them straightforward answers. We try to give them those Socratic
Right.
questions to say, hey, well, what are you thinking? What is your first thought? Those kind of things.
Right.
So it makes me feel good that we are actually on the right track for that. But yeah, I mean, it really works. And we haven't had any problems with our students as far as, like totally taking them off track if we stop it. So we stop it, let them ask their question. And 9 times out of 10, they've answered their own question by the time, we've got the simulation paused, and it's very helpful, but it doesn't alter the scenario at all, or it hasn't so far.
Mm-hmm. Thank you, Valerie. And we talked about lifesavers early on some of our earlier sessions. Those are also times where you're able to pause or, say you want to protect that psychological safe environment, especially when we're forming that learning, So that's your difference between your form. What is the goal of your simulation? Is it a summative simulation, or is it a formative simulation? That helps you really, have that liberty to do that within your session.
And I think really it's all about the objective for
The learning objective,
the
yeah.
learning objectives for the
Mhm.
scenario. With EMTs, we did a sim or scenario for them to go over their ABCs, right? So you stop the bleed and then you address your ABCs, right? Because you got to plug it up, otherwise you're going to do CPR and you're going to squirt all the blood out, right? So you got to plug the hole, just to put it in simple terms. So we ran the sim and we had a patient, quote unquote, who was bleeding out, and then they needed to start CPR. So one of the students, the EMTs, are working as a team. As they go into the room, he realizes the patient is bleeding. So he grabs a towel that was in not the most sanitary place, and he applies pressure to stop the bleed. And you're like, okay, he wasn't supposed to do that, but let's see what happens next. So they resuscitated the patient, but then during debrief, I'm like, okay, does anyone see what we could have done better? So as they're watching the video, they're like, oh my God, did you really take that towel and put it on your patient? So it depends on what your objective is at the time. So everyone, and even the student, he was like, yeah, but I didn't know what else to do. So it was one of those learning experiences. And like you said, what was the objective? We wanted them to make sure they did the ABCs, but at the end we reviewed it and say, okay, what do you see? What was, what could we have changed? And it was quite interesting to get everybody's reaction.
And that's a good point, because if it's not for that patient to die, that's not the objective of that sim. You're going to make sure you pause those students, because you got to protect their psychological safety as well. You got to pause it and try to redirect them so that they can get on to the achieving the learning objectives of respiratory distress.
Right. I didn't think by stopping them at that point to say, oh no, you picked up this towel and you're stopping the bleed. However, sterile technique and infection, you would have taken the whole sim to a whole nother area, down another venue, which would have been a different lesson. But at the end, when you had an opportunity to teach, that this was not appropriate. Your patient's family will sue you if they get infection.
And you did it in the appropriate place in debriefing. And even in that debriefing, we have to be careful that we don't go and have a whole lecture. You know, how do you keep asking those questions to get the students to start talking about, oh my goodness, I shouldn't have picked that up. And then you'll say, okay, so why are you saying why are you saying you shouldn't have picked that up? So tell us, what would you do differently, or what? Then they start answering themselves. That's what we want to happen. That's what you want to happen. Because in the classroom, we're lecturing, but in SIM, we're teaching in a different way. You're allowing the students to self-reflect, right? And make those connections. That's what makes it so powerful, because then they're able to remember that when they go back out into the hospital, their behavior is going to change because they were able to turn it on. They were able to make that connection. Good, 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 good. Thank you. Thanks, everybody. Thank you, thank you, thank you. Good question, Erica. Thank you. Formative versus summative. Let's see, where are we? On number 2? Number 2, a faculty member plans to evaluate simulation participants according to Kirkpatrick's level of evaluation. In order to determine that the participant has reached level 4, what should be the focus of the evaluation? What should be the focus of the evaluation? Level 4. A, the participant's satisfaction with the simulation experience. B, the participant's perception of their learning following the simulation. C, the change noted in the participant's behavior following the simulation. D, the change in outcomes noted in the patient's care following the simulation. Our answer is D. Adam, can you tell me why you chose D, Kirkpatrick's level 4?
Yeah, because level 4 has to do with patient care. It's also the, trying to remember the name of it. Not analysis. It's the 4th level.
Yep.
It has to do with patient care.
Yeah, outcome. Looking at your results. Looking at the results. And that's that highest level, right? When they go out and they do, right? And they're actually able to see patient outcomes, that what the behavior, them changing and not picking that up and picking it up from the right place, not transferring and putting that dirty towel on that patient. You know, they don't do that, right? And it changes that patient outcome, because guess what? We minimized infection. Patient did not. Yeah. So your first level is reaction, which we clearly could see that satisfaction in the simulation. How do you feel? What went well? And then we had the learning. What did you learn from it? And then level 3, we can see that in number C, the behavior changes once they go out and practice. And D, outcomes, patient outcomes are changed. So level 4 is D. Level 4 is D. And that's an area we really still need a whole lot more research to really prove that that's actually happening, that patient outcomes are changing. The 4th level of Kirkpatrick's learning achievement theory is application in the clinical area, or translation to practice. The 1st level of Kirkpatrick's levels of learning is reaction to the sim, which would be satisfaction. The 2nd level is learning, and the 3rd level is that change in behavior. Thank you so much. Number 3, a faculty member has asked where to begin in creating an effective learning evaluation for their planned simulation learning experience. Which of the following would you say is the first step in this process? What is the first step in the process? A, use an evaluation that's been used successfully before. B, identify learning objectives to be evaluated. C, assess the background and knowledge level of the learners. Or D, conduct statistical item analysis to determine reliability. And I'm thankful everybody said B. Everybody remember, you always start with your what? Learning objectives. Your learning objective will drive your SIM. It will drive your evaluation tool as well. So what are those learning objectives? What are we trying to achieve? Start with the learning outcomes that need to be accomplished. Using a reliable and previously used evaluation tool may work if the evaluation aligns with the student learning outcomes. The simulation-based learning experience should be at the right level for the student learning. The right level for the student learning. but the student learning outcome should be leveled so that it is known. So that it is known. Identify those learning objectives. What are our learning objectives? What are we trying to evaluate? Number 4, which situation would be most appropriate to use a checklist type evaluation instrument? We have a summative assessment of a nursing student inserting a urinary catheter. B, a summative assessment of a staff nurse's ability to recognize an unstable patient. C, formative assessment of a resident's ability to achieve an accurate differential diagnosis. D, high stakes evaluation of a medical student's ability to empathetically communicate with a patient. Yes, A is your correct answer. A is the correct answer. Anybody want to share why they chose A? Why did you choose A?
It's procedural based.
Yes, exactly. Right. Yep. Procedural based and checklists are the best form of evaluation when you have what? A procedural activity. Checklist evaluation is your best tool to choose for procedural type of skills evaluations. Inserting a Foley is a procedure that lends itself to a checklist. The ability to recognize a deteriorating patient condition is clinical reasoning and does not lend itself to a checklist. Differential diagnoses are done using clinical judgment or an algorithm, not a checklist. Communication is an affective skill and is difficult to categorize on a checklist. Good tool for procedural skills or procedural type activities is a checklist. Number 5, a simulation educator setting up a new summative evaluation and wants to ensure inter-rater reliability. The best method to ensure interrelated reliability would be A, 2 students evaluating each other, B, a checklist of summative evaluation, C, 2 facilitators evaluating a simulation using the same instrument, D, 2 facilitators evaluating a simulation using different instruments. I would love to hear why we chose C. C is the correct answer. Can we share?
I guess, inter-rater reliability. So you want 2 raters. And you want to make sure that if they both use the same tool, that they'll come up with the same results or same answers. So we want to make sure that it is a reliable tool that can be used in that way.
Exactly. When you look at your other choices, that is, you will not be able to achieve that. 2 students, no. A checklist, we've already talked about the use for a checklist evaluation. And then D, using different instruments, took it out of the interrelated reliability. 2 facilitators evaluating a simulation using different tools, disqualified that as your answer. They need to have the same tool and 2 people using the same tool for the same type of activity and evaluating the same scenario. Interrelated reliability can be confirmed by 2 evaluators looking at the same scenario and evaluating the simulation or the scenario with a single evaluated form, and then comparing the results. Students are usually not responsible for summative evaluations. A checklist can still be subjective if it is not validated. Using different instruments does not assist with the interrelater reliability. You have to say that one slow. Okay. Number 6. Additional rigorous research and evidence-based practice appraisals are needed to ensure A, students are satisfied with the simulation learning experience, B, faculty are competent in providing simulation learning experiences, C, simulation is meeting learners' outcome, or D, simulation is impacting safe patient care. Yeah, and we've talked about that. I made mention of that tonight, and I think we've talked about it in our last session as well. Especially when you look at Kilpatrick's model. Simulation impacting safe patient care. We need more studies in that area. Evidence demonstrates that students' perceptions are positive and that the faculty is competent in meeting student learning outcomes. When you want to go and look and see if what they're actually doing changes patient outcomes, that's an area where we need more studies and more information to really prove that that is what is actually happening. Now, in your hospitals, those in situ sims, you can see a lot more, right? Because they're actually in there performing those simulations on those units, able to create those bundles on those units and collect the data to see if the bundle was effective, right? Based on simulation experience that they did prior to the bundle. If there is a incident that happens, a sentinel event, they're able to use simulation there to try to reenact the event to see what actually happened, what was the root cause analysis, and based on that, they're able to generate or change, create policies or change the way nurses are doing things on their units. But there still needs to be a whole lot more information in that area when it comes to simulation. Number 7, expert simulation educator understands that a high-quality simulation learning experience should begin with A, resource management, B, clear learning objectives, C, participants in mind, D, secure technology needs. Yes, learning objectives, clear learning objectives in mind. The tool should reflect the tool, starting with the student learning outcomes, provide guidance to the learning activities and the type of simulation being used. Resource management, participants, and technology needs are important, but not the first consideration. B is our correct answer. Number 8, when choosing an evaluation tool for a simulation learning experience, it should reflect A, the students involved, B, the technology used, C, the faculty's expertise, or D, the learning domain. Exactly. The learning domain. What is the purpose of this sim? What are we evaluating? What is our goal? The tool should reflect what the purpose of the learning is, and this includes the domains of learning, such as, remember, we talked about those in times past, cognitive, psychomotor, and affective. Cognitive, psychomotor, and affective. The technology is chosen after the learning domains have been identified. Faculty expertise is then considered. So where are we aiming? Which area are we aiming to evaluate? Number 9, needed simulation research should be focused on which level of evaluation? A, reaction, B, learning, C, behavior, D, results. You've heard this one 3 times tonight, and D is your correct answer. Looking at Kilpatrick's model again. And we talked about, I sent some information on Kilpatrick's model in our document that we gave last week. Results and application to the patient care are the ultimate outcomes of simulation learning. Reaction, learning, and behavior all leads up to those results. And then number 10, an educator wants to evaluate learning that ultimately impacts patient care. What level of translational research should be the focus of the evaluation? If we're looking at outcome of care. And the answer is, let's see. Yes, it is C, because he only had 3 levels. So this one is just one talking about the translational level. Level 1, level 2, and then level 3. Level 1 was when the students were in either the sim lab or the skills lab. Level 2 is when they're actually going out to practice to actually do provide the care to the patient. And then level 3 will look at the results, the outcome in the patients. So that would be answer, it would be T3. T3 is the results of the simulation activity that improve patient outcomes. As the name implies, evidence is required to prove the translation to practice, and this requires measurable outcomes at every level. T1 is translation to humans, 2 translation to patients. T4 is not even a level at all. Again, when we're thinking about theories and models, making sure we understand each component of the model, not as much as the name of it, as we're going to have to do recall and say, what does this theory actually say? But understanding the principles of those theories and how they overlay and how we transfer them into creating our simulations, evaluating our simulations, our students, and even evaluation of you as a simulator as well, simulation educator as well. Okay. All right, we're rolling pretty good. It's 7:24. We'll go ahead on to our next quiz in chapter 20. This actually is talking about professional development in healthcare simulation. Let's see. I'm gonna look at our time. We're rolling good. We'll take a break at 7:30. Let's see, it's almost that time. Let's see. 5 minutes. So we spend a little bit more time on chapter 19. You feel like you're able to, let's go ahead and do number 20 and save that one for the end. Y'all feel like let's pressing forward? All right, well, let's go. On page 341. Chapter 20. Fostering professional development in healthcare simulation. All right. Number 1, the expert healthcare simulation educator understands the governing principles of simulation education when they state: A, simulation is routine learning for health professionals. B, simulation assists society at large. C, simulation's goal is better learning outcomes. D, using simulation assists in procedural practice. That's correct. Purpose of simulation, better learning outcomes. Correct. Let's see who rather. Let's see. Kim, can you share with us why you chose C for number 1, please?
I selected C because of learning outcomes should be the first thing that we identify, and then the objectives with it, and the so because it said learning outcomes is our ultimate goal.
So when you look at A, simulation is routine learning for health professions. The governing principle of simulation education is outcome, right? Learning outcome for the student, which transfer into safe practices for our patients out in practice, right? So the goal of simulation education is to reach the learning outcomes of healthcare students. Simulation may assist society because professionals learn well through simulation, but the goal is learning how to provide safe care for our patients, learning how to have safe practices once we're out into our areas of healthcare. Simulation may assist society because professionals learn well through simulation, but the goal is learning. Simulation is not just for procedures, and it is not routine. Number 2, a simulation educator would like to develop a social contract, okay, with learners and should include a social contract with learners and should include A, students understanding their roles. B, society supporting the students' roles. C, society trusting the work of the students. And D, students being concerned with public values. I would love to hear your choice. Why did you choose C? C is correct. Anybody want to share? In any type of social contract, a social interaction, trust is one of the priorities, isn't it, right?
I thought of C when I'm thinking of clinical rotations. People, when you go into enter a patient's room and you want them to allow a student to be able to practice, so to speak, their skills. on them. So they have to trust that
Trust.
the student is prepared to start that IV or insert that catheter. There's a level of trust that is involved there.
That one is a tricky question, Valerie, when you read it. It really, really is. But I had to look at it from the same perspective. When you thinking about interacting with the public and out and doing what we do as professionals, trust is at the priority of that. Yeah, you know your role and they know that you're out there being a nurse or that you're a student, but when you think about the ultimate opportunity to be able to be that professional and do what we do as professionals, and you, like she used the student role, they got to be able to trust. And this is talking about how we are doing our professional development. That's what this chapter is about, educational principles. So it's also looking at how we are developing professionally. Are we keeping up with this? Are we performing by standards? Are we executing those standards in our practices as we're going out? Are we continuing to do professional development so that we are providing care that is evidence-based, producing safe patient outcomes? So when you think about that, the one that actually can see and know, they're going to trust us probably more to be able to do that. In the area when we get ready to provide health care. Understanding your roles, yes. Society supporting the student's role, but them trusting, when I had to look at all four of those choices, trust would be the one that would be my best answer as well, as in regards to creating those social contracts or those agreements that we can come in and be those professionals to actually provide that care, even in the learner's role. Society entrusts the service work of individuals and credentials them. Students do need to understand their roles and public values in all aspects, and society should support the student's role of becoming that health professional. They're student nurses now. However, the major issue is trust. And some patients don't want student nurses coming into their room. They rather, no, I don't want a student nurse. So really that CI has to go in and get permission and make sure that they're assigning students to those patients that give, that feel like they can trust, you bringing your learners into their space to take care of them in the clinical setting. And even, I think about Adam, your CRNA, you really have to get, well, your patients are in a different place. Adam.
Now your patients are unconscious. They can't object.
Yeah. So they won't really know, but as those of us that are in academia with our nursing students, we do have to make sure that we have that extra. Hence, that's why we put them in simulation, right? We want to help them in simulation, develop behaviors that will allow them to be safe so that when we do go out into our units on our floors, that the patients there and even the faculty and staff, the staff members on your units are even trust that we're safe. Because sometimes the nurses on the units have trouble having students on board on the units because they don't quite trust. And not knowing the level of your student, it can even interfere with how they trust that student to be able to take care of the patient. Number 3, simulation educators understand that they are responsible for maintaining standards of practice. We are responsible for maintaining standards of practice by A, ensuring experts teach simulation to novice educators, critical analysis of best practice. C, solidifying practices used successfully. D, maintaining a specific set of skills. How are standards of best practice developed? How are they developed? Exactly, through critical analysis. Analyzing those standards. Taking them apart. Is it relevant? Is it evidence-based? B is your correct answer. Makes room for updating, making sure that we're relevant. And that's how the standards are created. Critically analyzing best practices for simulation is the best method for simulation educators. to keep using best practices in teaching students. Not just novice simulation educators, expert teachers may or may not be using best practices. Solidifying practices used successfully does not analyze those practices for more up-to-date techniques. Having a specific skill set means that those skills may need to be updated when new evidence is produced. That's why we have to keep making sure we are doing continuous professional development, going to conferences, reading articles, keeping up with best practices. And even as they've done some reviewing and even now looking at the NASCL standards, you know, those standards are evolving as we speak right now. You know, going back just to look to see if everything is still relevant. Is it still in alignment with best practice? Are these things still working? Are these things still providing safe patient outcomes? Critical analysis leads to best practice. 4, in academia, simulation educators understand that continuous professional development in simulation assists professionals to improve. Now, this one I'm interested to see how we take on this one. A, career advancement. B, debriefing techniques. C, effective communication. D, the art of moulage. And think about it from the organizational perspective. Within your organization, yes, continuous professional development positions you for career advancements. Exactly. Yep, that's correct. We can learn debriefing techniques, effective communication. When we're thinking about it from an organizational standpoint, it really leads to career advancement. Learning new debriefing techniques, effective communication, increasing moulage skills are good competencies that we learn through our continuing professional development opportunities. But when you think about it from an organizational perspective, career advancement is where it's at. It is the most valuable outcome for academic simulation educators. It's why some programs require that you have your CHSE, right? Especially in the roles that you're in your facilities or in your organizations and your academic environments. Number 5, a simulation educator asked their mentor what method would be best to advance from an assistant to an associate professor of healthcare simulation. Organizational, again, the mentor should advise the simulation educator to do what? Kind of reinforcing the one with the question we just, participate in continuous professional development. Same rationale as we were discussing earlier for the question previous. Participating in continuous professional development will increase the networking and opportunities for scholarship and provide examples of simulation teaching excellence. Online courses can assist in promotion if they contribute to your degree. Analyzing outcomes is always good for process improvement. Fidelity should be used in relationship to the student learning outcomes. But we're talking about your professional advancement as a simulation educator. Number 6, the novice simulation educator needs additional mentoring about continuous professional development for healthcare simulation. For healthcare simulation educators, when they state that continuous professional development, A, increases knowledge about systems, structures, and organizational cultures. B, addresses basic knowledge, skills, and attitudes. C, increase engagement in the learning process. And D, promotes learning outcome for teacher and students. I would love to hear your rationale for choosing B. Lori, can you tell me your rationale for choosing B?
Sure. We would hope that they would be past the basic stage if they were in increasing their own learning opportunities and doing their professional development. So that would not be a good answer there. Promoting learning outcomes is good. Again, it's not at the basic level because what we're doing is everything we do is about the student and advancing those learning outcomes, making sure they're performing at that level. So I just don't think it addresses basic meal. We're above that.
Anybody else? Thank you. Thank you, Lori. Because when we look at A, continuous professional development, it increases our knowledge, right? So we know that was correct. It increases knowledge about systems, structures, and organizational cultures. It increases engagement in the learning process because as we get into professional development, we start learning and we want to keep learning and keep learning and keep learning. Let's see, promotes learning outcomes for teachers and students. Addresses basic knowledge, skills, and attitudes. It doesn't solely do that. It pushes us forward past that initially, but it's not focused on addressing your knowledge, skills, and attitudes. Addresses more than just the basic knowledge, skills, and attitudes. Continuous professional development addresses knowledge about system structures and organizational cultures. It promotes learning and increases engagement. So it just doesn't settle there with our KSAs. It kind of advances us past that to the places of expert. Number 7, an expert simulation educator understands that for simulation development, they should what? Consider their organization's A, financial burden and employee compensation, B, career trajectory and professional growth, C, future organizational structure and changes, D, agendas of management and leadership. What is the future structure? Yep, and changes. Exactly. Future organizational structures and changes should be considered. This will affect the simulation programming. Financial issues are important to maintain a simulation program. Career trajectory and professional growth of simulation educators are important, but must be supported by the organization in which they are employed. Agendas of leadership and management are important in the development of simulation programs, but people can easily change. Future consideration will position the simulation program well to thrive. So what is the future of the organization? Let's see. Number 8, the simulation educator is choosing to practice crucial conversations in professional healthcare situations with advanced learners. A common issue to highlight in the scenario would be A, promotion, B, diversity, C, compensation, or D, leadership. Yes, B, diversity. B, diversity is a common issue that comes to light in crucial conversations. When you look at your choices, D would be your correct answer. Promotion, compensation, and leadership are other issues that possibly can be part of a crucial conversation, but diversity is the one that's most crucial and sensitive. Number 9, the simulation educator understands that the graduate student needs further understanding when they list which of the following attributes in developing self-efficacy in simulation. A, relevancy, B, credibility, C, knowledge, or D, critical thinking. Mm-hmm. Yep, D is correct. D is correct. Critical thinking is not even an attribute of self-efficacy. So we kind of get, if you didn't know, you could do that one by process of elimination. Relevancy and credibility and knowledge all are part of self-efficacy. Number 10, the simulation educator understands that the third step of negotiating a professional role that can be fostered in a simulation scenario is A, feeling like an imposter, B, taking the role seriously, C, trial and error, D, transference. Mm-hmm. And watching our students and watching even ourselves go through that is pretty interesting. B is your correct answer, taking this role seriously and watching those different phases really come to pass. Taking the role seriously is the third step. Feeling like an imposter is the first, trial and error is the second, and transference is the fourth, and professionalism is the fifth. What does that look like when we see it rolled out in practice? So taking that role seriously. All right, my family, we are at the end of chapter 20. At this point, we're going to take our next 15-minute break. It's 7:44. We'll be back at, we'll go ahead and come back at 8. We'll come back at 8. So we will log back on at 8 and finish up our last chapter of the night, chapter 21, which is talking about the role of simulation, the role of research in simulation, the role of research in simulation. 7:50. All right, we are back with our final chapter of the night. Everybody okay? We're good? Thumbs up, thumbs down? We good? Okay. We're coming to the end. Good, good, good. All right, all
I'm
right.
just trying to warm up right now, so you're gonna see me in a blanket. We're in a blizzard warning starting in the middle of the night tonight again.
Oh my goodness. Woo.
I'm so cold today. It was like 70 degrees yesterday, and now tomorrow in a blizzard.
Oh, wow. Mm-mm-mm. Well, you try to stay warm as much as you can over there. We on page 361, chapter 21, and we're looking at research, the role of research in simulation, the role of research in simulation. Okay. All right. Number 1, the novice simulation educator needs additional understanding when they state A, pre-briefing sets the stage for the scenario and assists participants in achieving learning objectives. B, pre-briefing activities include creating a fictional contract and orienting participants to their roles, equipment, and scenario. C, during pre-briefing, it is important to emphasize that perfection is expected. Or D, the main objective of pre-briefing is to set the tone for learning. Correct. Our answer is C. Adam, would you like to share with everybody why you chose C?
Yeah, perfection is never the goal.
Exactly. Students should be allowed, right, to make those mistakes. That's the purpose of simulation in a safe environment, right? And in pre-briefing, we want to set that tone. Our goal is to establish psychological safety. We go over our fiction contract. We go over the students' expectations, their roles. We do talk about all the activities, the timing, all of those things are done. Any equipment that they may need to review during that pre-briefing time, anything that we need to do for that student to make that next phase of that simulation day be a safe day for them. We do that in that pre-briefing time. It is not a time of perfection. You're correct. That's not what simulation is all about. Perfection is not an expectation. Nope, 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 nope. I often tell my students, if you're gonna make a mistake and if you have any gaps in learning or any trouble with any of your skills or concepts, we want to see your real self here because this is where we're able to help you. Perfection is not an expectation, and this is an issue that can be addressed during pre-briefing. Pre-briefing does include fictional contracts and assists in staging and setting the tone for learning. NASCO has an article, and if you haven't read it yet, I do encourage you to go look at that article on briefing, simulation briefing. Number 2, the novice simulation educator needs additional understanding to the NLN's Jeffrey simulation theory when they state one of the components is A, educational practices, B, student learning, C, design characteristics, D, participant. This one is another one with theory, right? Your nursing theories. And I sent a sheet out last week with theories. Don't know if I had NLN on there, Jeffries, but again, you're thinking about the principles of those theories and how they overlay and are executed in our simulation. So we look at the things that are part of her theory and the things are not. It's B, student learning. B is your answer. Participants include all learners, not just your students, and can include others taking roles during the simulation. Simulations always include a design and educational practices. So B is your correct answer. Number 3, a skill simulation educator plans time in the simulation to include which of the following? One of our favorite times of simulation. A, flexibility in the length of time for the debrief, 10-minute orientation and pre-brief. C, time to watch the entire video. D, allow 10 minutes for participants to write a reflection paper during the debrief. Yes, yes, yes. Debriefing. A is correct. That would be exactly flexibility in the length of time for the debrief. Any part of your simulated day that you would like to be more flexible, that would be with your debriefing. That's where all of our learning, they're able to really unpack the scenario. We're actually able to have those students self-reflect. And self-reflection for one student may look different than self-reflection for another student. And how we provide them the opportunity to do that in debriefing is very important. So flexibility, A, is your correct answer. Flexibility in debriefing is needed because different groups may react differently to scenarios, and it is important not to rush the debriefing part of your day. This learning phase of simulation, you do not want to rush it. Writing a reflection paper, watching a video, and pre-briefing do not need exact times because in some of these instances, they may take longer than others, depending on the subject and the complexity of the scenario. Number 4, the simulation educator understands. Here we go with Kilpatrick's 4-level learning theory of evaluation. We've heard that a lot. Kilpatrick's learning, that are successful when their learners reach which level of Kilpatrick's 4-level learning theory of evaluation? A, results, B, learning, C, reaction, D, behavior. Exactly, results. That's our last level, right? Results. Reaction is our first level. And then we go to what did they learn? And then D, what does that behavior look like when they go to clinicals? And A, what are the results? What are the patient outcomes? Let's look at our rationale. Yep, results in patient care is the ultimate learning goal. Reaction is your first stage, learning is your second, and behavior is the third stage that leads up to the results. And I did provide an example on your theory document on what that looks like in a simulated experience. So make sure you check that out. Number 5, which is a participant reaction to simulation that has not been supported by research? Which participant reaction has not been supported by research? A, that participants learn to think critically and problem solve. B, that participants are allowed to make mistakes. C, that participants experience improved self-confidence. Or D, that participants express a lack of anxiety. Exactly, D, because they are anxious, aren't they? Yes, 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 they are. Yes, D is your answer, is your correct answer. Participants do experience some anxiety because they are expected to treat the situation as what? Real. And they may be unfamiliar with the condition being displayed in the simulation scenario. Simulation assists in critical thinking development and improve confidence, self-confidence. Participants are allowed to make mistakes and learn from their mistakes in simulation. And we can find a lot of research to support A, B, and C. Number 6, which two learning domains overlap in simulation? And what are our learning domains again? Cognitive and psychomotor, A. B, affective and psychomotor, C, cognitive and affective, D, respondent and cognitive. Which two overlap? Okay, well, let's have a little conversation about this one. Somebody tell me why you chose A. A is correct. Cognitive and psychomotor. How do they overlap? Who would like to talk about that?
In simulation, it's you do. So that's your psychomotor. And in order to demonstrate that you know what you're doing, in simulation, you have to physically do it.
Exactly. A
It's
knowing
not
and a
it's not
doing.
like a test.
A knowing and a doing, knowing and implementation. And we're also having them critically think in the sim lab, right? And they're also doing skills that go along or interventions along with their responses to the patient's behavior. So cognitively, they got to be able to critically think, right? And not only critically think on what's next, but also be able to do those hands-on, those skills that are appropriate for patient care within the simulation. So that's why we're seeing that overlap. Critical thinking as well as implementation of skills, right? Cognitive and psychomotor overlap because learners need to know what they're doing in order to demonstrate the competency. Affective does not have to be part of the skills attainment unless a standardized patient is present. Responding is not a learning domain. And make sure we review. We went over domains, I think, earlier in our time together. So make sure you go back over those domains. Number 7, which learning method used during debriefing leads the patient to a higher level of critical thinking? A, responding, B, reflection, C, interpreting, D, noticing. Exactly, self-reflection in debriefing. And that's the whole power of debriefing. That's why we don't want to rush the debriefing process. Students are able to reflect on their behavior, right? Reflect on what was done. Let's see, debriefing is important. Oh, I'm at number 7. Reflection leads to critical thinking because it assists the learners in evaluating their own behavior and how they can improve their behavior. Responding, interpreting, noticing do not necessarily promote reflection. The power of reflection in debriefing, that is one of our sole purposes in debriefing, is the power of reflection. Causing them to reflect back over their behavior or the behavior of another or the patient themselves, especially when we do our video debriefing. And in that reflection, they start to thinking. And we keep asking those different questions depending on which debriefing technique that we use. Debriefing by meaningful learning or judgment. And we're able to pull those reflections out of our students. I don't know if I've told you my thing about simulation. It reminds me of popcorn, especially when we get into debriefing. When you're asking the right questions, you turn that heat up on those kernels on the stove, and all of a sudden you just start seeing learning just pop all around that room. As they reflect, the other reflect, and learning just starts evolving. Number 8, to maintain participant motivation and self-esteem during simulation, what is the best role for the debriefer to assume? And remember the role in remember what debriefing is, the goal of debriefing, and what is our role as a facilitator. Oh, Lord, I just gave you the answer. A, advisor, B, mentor, C, coach, or D, facilitator. The answer is facilitator. I got caught up with my popcorn story. I'm sorry. The answer is D, facilitator. Exactly. We're not there to advise or be a mentor or coach, but in debriefing, we are facilitating learning. Facilitation assists in keeping the learners engaged and on task without spoon feeding them the information to the students. Advising and mentoring provides a more learner passive role, and coaching provides learner engagement with more direction from the simulation educator than facilitating. We are facilitating that learning process. Number 9, which organization promotes competence, recognition, and development of healthcare facilitators through accreditation standards and processes for certification? Exactly, SSH. Society of Simulation and Health. Yep. And NASCO, they're the ones that provide our what? Our standards. Assists with simulation development, and ASPE is for our standardized patient. And ANCC is for our accreditation of nurses. Number 10, what is the most effective component of simulation-based education and the cornerstone of the learning experience? Yes. C, debriefing. The most effective component of simulation-based education is the debriefing process, hence why there is a great need for you to be an expert in that debriefing process, trained in debriefing, because it is the cornerstone. It is the most important part of the simulation experience. Debriefing is important because it's where the learner reflects. And again, where learning comes alive, that time of reflection, and uses the experience to improve competencies. Pre-briefing and the simulation experience are important, but the majority of learning takes place where? In the debriefing phase. Don't rush it. Lifesavers are part of a simulation experience. Oh, we talked about that earlier. The word lifesaver came up, and are needed to keep learners what? On track. Okay. We are ahead of the game. Y'all had a long day today, so something's happening. We got ahead of the game. We still have 15 minutes. Is everybody good? Went through these last few chapters pretty quick. Research and the professional development. But this entire section is about 40% of our CHSE exam. So I don't want us to take it lightly. Does anyone have any questions? Any feedback? Any pearls you would like to share in our space tonight? Everybody good? Adam, you good? And I just chose your name because you're up first. You okay? Good. Did you say yes? I'm sorry, I didn't see you.
Yes, I'm good. Thank
Okay,
you.
good. Lori, I see thumbs up. Let's see, Charlene, you good? Let me see, go down my list here. Erica, you good? Oh, Kim, I see your hand up. Erica, you good? She's thumbs up. And Valerie's thumbs up. Okay. All right. Please email me. Valerie, if you could stay on, I just had a question for you, okay? Everybody else, are you good? Email me if you have any questions. If it's okay with you, we'll go ahead and end unless you guys just want to go and talk some more. Everybody good? Shirley's like, yeah. Lori's like, yes, it's been a long day. So go get some rest. Okay? Rest. Our next session, you're going to have more questions, okay? Because we're going to do that cumulative exam at the end. We won't do the whole. It's 100 questions. We won't do all of it, okay? All right. Val, if you'll hang on for me, okay? Thank you, everybody. Y'all have a good evening. Kim, please stay warm. You're welcome, Adam.
I'll stay warm. Yep. Yeah.
All right.
I have the thermostat turned way up here. And my
Oh, my
husband's like,
goodness.
we just filled the LP gas tank and you're using it. But Minnesota has been all over with the
Uh-huh.
weather. And
Uh-huh.
yeah, we're supposed to get some areas up to 10 inches of snow, but 50-mile-an-hour winds.